the discussion is focusing to combine the twin issues of quality and then access. And when one talks about quality, then quality improvement becomes even more important, because then we are talking about innovative solutions. These are local solutions that are harnessing the creative energies of frontline staff. And then, of course, when the leaders are involved in that conversation, it means that they can have a more structured, approach, and then they can create the kind of environment within which quality improvement can thrive.
Quality improvement is critical. If you want to transform a system, if you want to ensure that the system is set up to deliver outcomes, to deliver improvements, to ensure that it's patient-centered, family-centered, you have to leverage quality improvement methodologies to make a sustainable difference.
It is critical that quality is imbibed to every aspect of the hospital, both the clinical and the non-clinical aspects of the hospital, because the non-clinical aspects of the hospital can impact the outcomes that you have in the clinical aspect of care.
We normally have a saying in our clinic that until the patient says thank you after paying for the services, we have not satisfied the patients. And by attending these courses, we now have a lot of tools to work with, to measure what we are doing and how we are achieving it and the landmark we are attaining.
The IHI models for quality improvement, the science of improvement, and the various topics that we've been taught by the IHI have helped see how we've been taught that quality of healthcare, safety of healthcare is important. But this module actually tells us how we are going to do it. We've learned all along why we have to do it, and this module tells us how, which is the problem most people have, because everybody wants quality healthcare, everybody wants to deliver that. But what we haven't known is how we're going to do it.
In terms of the way the training was done, we have a particular way in which we organize the seating. They were put into groups, and they all did not necessarily come from the same facilities. But the whole idea was to get them to work together as teams, to learn more about each other, and to also learn from each other. And I think this worked very well, because not all of them were working in the same care processes. And yet they were able to take some of the general concepts around quality improvement and apply it to their settings. And they had an opportunity to brief and to get feedback from their peers. And I think that also worked very well. So overall, I think it's been satisfactory.
I think what this team has shown during the interactions is that they have gotten the principles on how to make quality actionable. So most times you go into a facility and you see an aim that says we want to deliver quality care. But prior to this, how to make that actionable in terms of practicalize that vision towards delivering quality care. And with the tools we taught them around setting very clear, smart aims and generating very innovative change ideas. We've taught them a lot of tools to innovate this and generate great change ideas that can help them achieve their aims, as well as measures. So putting it down to the nitty-gritty to say, let's not be vague about improvements. Let us be able to use data to show that we're really improving. And living here, everybody living here is going into their facilities to constitute quality improvement teams and to start practicalizing what they have learned in class.
I would assume that building capacity in quality improvement is just a step in a very long process. Quality does take time, and it's the beginning of a journey. So I would hope that beyond the training that we have offered, it will fit into a long-term plan to transform the care process within their facilities. So it shouldn't end here. There should be an ongoing strategy, because really we say that to bring about improvement, there should be changes, and the changes are not really in this room. They are the front line. And it's about improving, saving lives and reducing harm. So at the bottom line, we want to see that those outcomes are being recorded.
I believe with the engagement that we've seen from the teams already, we believe, and from what they've come back to us with, they really are imbibing this information. And we believe that they're going to take this for the future. We're going to see sustainable changes in their systems, and we hope that they transform the greater healthcare system, share, teach, and build. It's not just for them, but it's for the systems that they're working on. Ultimately, who is it for? It's for the patient. It's for the Nigerian patient. It's for the African patient. And we hope that we're going to see a difference in the communities and the patients that we serve, where they believe that they have the right to the right type of quality, the right type of care delivered the right time, every single time in the right manner all the time.
If we go by the success of this study, I think it's going to be, so far, at least the uptake of the program so far, I think it would certainly go a long way, and to my mind, almost the only way, because we've gone to medical school, we've done postgraduate training, we've sent nurses on training, and various other health specialists have learned all the technical parts of their job. But this course brings everything together, unifies all the parts, and makes everyone see and realize that no part is more important. And it also teaches us how we're going to work together to that common goal of patient safety and the quality of health care. So this course is certainly instrumental in improving healthcare.
With the way this first cohort is going, my prediction is that this is going to be the start of a revolution, that this is going to explode, that the coverage is going to increase both in Lagos and in other parts of the country, that we are with this, at this time, beginning to, make the right crop, generate and build an army of health managers, health leaders, health hospital management leaders that are equipped with the right tools to transform the healthcare system.